Now, when we talk about the environmental risk factors, these are ones that can result in someone having that accidental fall. The two types of falls that are preventable: accidental falls and anticipated physiological falls. So all of you, for each and every patient, should know what are their extrinsic risk factors that are associated with toileting related falls, because we know that people are trying to get up, especially during the night. They're trying to get up and go to the bathroom. So what's important is to look at bed height. Bed height should be individualized to every one of the residents that you're taking care of for what height that bed should be raised to for them to be able to safely transfer, whether it's a sliding transfer on a slide board or a stand pivot transfer, or whether or not you're trying to help them get to a standing position to use the walker. So bed height should be adjusted so that, if you will, the hip is at a 90-degree angle. You've got the back and you've got the hip and you've got a 90-degree angle. I hope you can see my hand here. If the angle it should be wider. If it's too short, if it's too small, too narrow, that angle, then you have someone's knees coming up to their chest and they're going to be trying to get up without you, trying to get up, and they're going to fall back down onto the bed or fall off the bed even as they're trying to stand up and push off the bed. So bed height is really important. It should be individualized. And I've had some organizations that have actually set up an individual bed height program where they actually put some kind of a tape or marking on the wall at the head of the bed so that everybody knows what height this bed should be raised for me versus Laura, because I'm almost 6 foot tall. I don't know what the height Laura is. Laura might be 5'5", but our heights are different. So you know what height the bed should be raised to be able to safely help someone stand up or transfer. Safe exit sides are really important, and I really advocate for these in all settings of care. And I bet that you're a best practice for this in the long-term care setting, but you should know what side of the bed someone should be getting out of. You can always position a chair to get someone back into the bed, but to be able to actually get out of the bed, knowing that people are going to try and get up without you, you should have them be getting out of bed towards the side of their bed that is their stronger side. And that's the safe exit side. So that's the bed transfer side. Creating a clear pathway to the bathroom if someone is trying to get to that bathroom. I've even had some places that have put glow-in-the-dark footsteps that actually where people can see, you know, when they get up during the night, what the pathway is to get to the bathroom. Toilet height is just as critical as bed height. And oftentimes our toilets are way too low. We put compensatory strategies, putting bedside commodes over them to compensate. But the bed height should be as important as, or toilet height as important as bed height. Certainly access and then the bedside commodes. And I think bedside commodes are underutilized in all settings of care. And that should be an evaluation. Who is safe to go to the bathroom and use the bathroom versus who is safer to be using a bedside commode. But for all of these interventions that you see here, ladies and gentlemen, if you set up these interventions, you're reducing the risk of an accidental fall because you're creating a safer environment for your resident.